Hi, everyone. I'm Raja Mittal, and with me is Akash Mishra. And today we'll be presenting our work on improving zero-shot detection of low prevalence chest pathologies using domain pre-trained language model. So our work primarily builds off this research called Check Zero, which uses CLIP from OpenAI and contrastive learning to learn pairings from chest X-ray images and their corresponding reports. This innovation allows us to circumvent using any explicitly annotated data sets, which are extremely expensive to use and typically useful for one disease at a time. And what our main improvement or main experiment is replacing the text towers in Check Zero with various domain-specific text towers, which are CXR BERT, BlueBERT, and Clinical BERT, which have been explicitly trained on relevant medical data and thus have seen descriptions of low prevalence diseases that don't appear often in our training data set. And we hypothesized that these domain pre-trained models offer the potential to improve the performance of Check Zero-like models because they have specific domain knowledge for low prevalence diseases, even though they come at the cost of breaking the original model's alignment. In this work, we start with the contrastive learning framework used by Check Zero and CLIP, which allow for us to do zero-shot multi-label classification. And CLIP contains two embedding models, a vision tower, which in our case is a ResNet 50, and a text tower, or BERT. The two embeddings produced by these towers are combined to find a similarity score for an image caption pair. In our work, we keep a lot of this pipeline, except we replace the BERT text tower with various domain-specific language models. We employ three language domain pre-training models. So these are CXR BERT, BlueBERT, and Clinical BERT, which we mentioned, and all of these have been pre-trained on various medical language data sets. CXR BERT was further pre-trained on Mimic CXR to specialize in the chest X-ray domain. For our own contrastive loss training, we then trained each model on the alignment task for 5 epochs using Mimic CXR data before doing a zero-shot evaluation on the chest X-ray pathology classification task. We follow the same zero-shot inference strategy as Check Zero for designing our captions from disease labels and for data augmentation. And then we compare our model to a baseline Check Zero model trained similarly and evaluate the relative performances on pathologies that were either common or pathologies that were rare in the training data set.
So here are our results. In this table, what we've done is we've reported the bootstrap AUC performance for the low prevalence pathologies from the Mimic CXR training set evaluated on the VIND CXR dataset. We see here that both Clinical BERT and CXR BERT outperform the baseline on a majority of the low prevalence pathologies, and the same cannot be said for common pathologies. Note that we defined occurrences as the number of Mimic CXR reports with impressions that contain the name of the pathology. As you can see here, CXR BERT outperforms all of them on these low prevalence pathologies such as lung tumor, aortic enlargement, enlarged pulmonary artery, and clavicle fracture. But on the other side, we see that the Check Zero baseline does better with pneumonia and the other common diseases as well. For our discussion section, we have a couple of key takeaways. We found that the pre-trained text towers show a strong performance on rarely mentioned diseases in the Mimic CXR alignment training dataset. The performance of zero-shot classifiers is affected when diseases have little or no mention in the alignment training dataset. In an ideal scenario, a model should produce a relevant image embedding and a text embedding tower should embed the new pathology to an aligned encoding for zero-shot classification. However, if the text tower has never been exposed to the new pathology, the likelihood of a meaningful text embedding is small. Pre-trained text towers trained on large datasets such as Mimic3 and PubMed abstracts can still perform well on rarer categories even after alignment training. And zero-shot classifiers for classifying a wide range of chest X-ray pathologies may require a domain pre-trained text tower in the future. Some possible options for achieving this include incorporating pre-training in the text encoder without compromising performance on common diseases and using a weighted ensemble of a domain pre-trained language model and a general BERT model. And those combinations may help achieve better model performances on low prevalence diseases.
And that's all. Thank you for listening.